These last few years have been tough on us, no doubt, but what about our children? Today we're talking about child and adolescent mental health and how to deal with emotional and behavioral challenges.
Dr. Armstrong joins us now. She is the acting chief psychologist, and today we're talking about youth mental health for National Suicide Prevention Awareness Month. First, thank you so much for being with us. Appreciate it.
Yeah, of course.
I wasn't aware that it was in need of an entire month, but apparently it's important enough to do so. And I would love for you to tell us how prevalent youth suicide in Hawaii actually is.
You know, it's really important because any suicide is something that we want to prevent. And although it's pretty uncommon in youth and young adults, it remains one of the leading causes of preventable death in this age group. Suicide rates nationally have increased for young adults and youth over the last 15 years, and Hawaii is no exception to this. So even though our youth are generally pretty healthy mentally and physically, even a small increase in the rate of suicide is something that we want to work on. So we want to share our resources and important information throughout this month to try to work on prevention.
I myself am a father. I have in our household at any given time, I have anywhere from a 12-year-old to a 22-year-old in the house. What are some of the signs that an adult should look for when a child is in their house, or maybe they're taking care of a keiki?
There's a lot of things that you can look out for. One of the most important things that you want to notice is behavior change. Anything that's a change in normal things that you would see from a kid. So maybe they're sleeping more than they used to, or maybe they're sleeping less, maybe they're eating more or less than they used to. And that in itself isn't going to tell you that they're suicidal, but if you notice those things together with maybe not enjoying the things that they used to do, not wanting to hang out with friends or talk to friends, isolating themselves more, or even becoming more irritable. For youth, sometimes depression symptoms aren't just feeling sad all the time. It might look like grumpy, angry, frustrated easily. So those are things you want to look out for. And then, of course, the most obvious sign is them talking about suicide or making statements like, I feel like I'm a burden, I feel hopeless, I want to hurt myself. So if you notice those kinds of things, you want to try to get them some help.
Okay, so that begs the next question then. What if I or someone that I know or someone out there knows of someone that's feeling those kind of tendencies and they need support? What then?
So there's a lot of really good resources. One of our really good resources in Hawaii is the Hawaii Cares line. And it's a line that people can call and get more support. So the number for that, for anyone in the state can call, it's 800-753-6879. And that is awesome because they can have someone that can talk to you, find out what supports are available for you. And if you really need someone right away, they can send out a support worker and they can evaluate the situation and help you get the support that you need. There's also the crisis text line. If you text Aloha to 741-741, then they have trained workers that talk to people and can help you when you're feeling suicidal. And adults can call that as well if they're worried about one of their youth.
We'll make sure that we have that information posted on our website shortly after the show. Go to KHON2.com for that, and we'll have links, of course. What other resources are there available for people struggling with, say, mental health issues?
Yeah, so the Child and Adolescent Mental Health Division, also called CAMD, where I work, is a service that's provided free mental health services to kids in the state. And we work with kids 3 to 21, and we're able to also provide services for youth who are 14 and up that want to seek services out on their own. The things that we offer, intensive in-home therapy where they can come and meet the kids in the home, all the way from, a variety of different resources, including helping with those kinds of suicidal ideation and kids that are struggling with that. There's also a Help Your Keiki website, which is just helpyourkeiki.com. And there's a lot of really good resources and information for parents who are kind of not knowing what to do, feeling at a loss, and a lot of evidence-based treatments and supports there that people can look at. And of course, if kids are in school, You can ask school counselors, school staff, students can ask, parents can ask if they feel like their kid is struggling. And there's a lot of well-qualified mental health professionals in the community. I think the best way to look for that is to ask your insurance, because then you kind of know who's covered under your insurance. And then, of course, reaching out to friends and family for support. We always encourage that, because those are people in your life on a day-to-day basis that can really help.
National Suicide Prevention Month. What type of events are planned for this time?
A lot of events that occurred this month, and there's still a few that are happening. We're kind of in the later part of the month. We had virtual walks and sign weavings, trainings, and lots of conferences. And there's information available at the Department of Health website. So if you go to that website, it lists all these different events that are happening across the islands and across the state this month to really increase support for preventing suicide.
We really appreciate your time. Again, the information, the phone numbers, the websites, and all the links that we need will be available on KH12.com shortly after the show. But we really want to thank you for your time on such an important topic. Thank you.
Yeah, thank you so much for having me. I really appreciate it.
Great topic. You and I are both parents. It's something that needs to have a frequent checkup.
That's right, and you hear more about the more time they're on the social media and what that does to the mental health too.
Video games.
Exactly, so a lot to keep track of, and we'll post all that contact information on our website.